Trey Hester. I'm going to talk to you today about how to use a metatarsal pad. To do this, you'll need three things: an insert that can be switched from shoe to shoe. Doesn't have to be any kind of fancy insert, just a regular cushioned shoe insert. The metatarsal pad, which we have here in clinic, and then a tube of lipstick that you're not going to use after this. So first off, trim the orthotic down to fit inside the shoe. And then once you've done that, take the lipstick, find the spot on your foot that's the most painful, just by pushing. Does that hurt? Mm-hmm. Is that the spot that's the most painful? Yes. And then you make a mark with the lipstick. Once you've done that, you put the shoe on. And then stand up and go up on your tiptoes a few times. Good. And have a seat back down. So now, when you take that off, you'll have a mark. And what you want to do is take the metatarsal pad, peel half of the sticky part off, and put it behind, leaving the main part of the mark out. And then you take half of it off to allow you to adjust the metatarsal pad further. Put that back in the shoe. And then slide that on and make sure it's in the right spot. As long as you've got it in the right spot, take the rest of the backing off of the insert. Yes. And that way it'll stick permanently. Now you can switch the insert from shoe to shoe to allow you to have that one metatarsal pad in multiple pairs of shoes. Thank you.